Angelo and his friends went to an old and abandoned house. They were having fun exploring the house. Not until he stepped into an old nail attached in the wood flooring. All of them were panicking and they accidentally pulled the nails out and caused bleeding. What are the things that you need to do if the injury is seriously bleeding?
If the injury is seriously bleeding, apply first aid. First, you need to disinfect some tweezers with rubbing alcohol and use them to remove debris in the wound as much as possible. Second, apply gentle pressure with a clean cloth to stop the bleeding. Third, you should apply antiseptic or antibiotic ointment or both to the wound area if available. After that, dress the wound with a clean bandage or any cloth materials that has with you.
Once you have dressed the wound of Angelo, you should seek medical care and advise him to not put too much weight on the foot, especially at night. Following the first aid can help you avoid having infection or tetanus. A second-year college student named Dave enjoyed playing volleyball during the annual intramurals. While having their training, he tried saving the ball and accidentally bumped his head into his teammate. He got a bruise on his forehead. What should you do? First, treat the bruise. Second, apply ice or compress it if there is no ice available. Then, rest until the symptoms disappear. Lastly, watch out for symptoms that needed emergency actions. During summertime, Justin and his friends are fond of playing traditional games like patintero. While he was running, he accidentally stumbles and falls. He got a minor scrape on his knees. What should you do to help Justin? First, you should wash your hand to help avoid the possibility of infection and check the scraping. Second, stop the bleeding by using clean fabric or gauze to apply pressure to the scrape. Third, remove debris with a clean cloth or sterile tweezers. Next, gently pat the wound with a clean cloth and apply antibiotic ointment. Lastly, use a clean non-stick bandage to cover the wound. And be sure to change your fan and gently wash the skin daily. Also, you should check signs of infection and if there is any, it is advisable for you to go and see a doctor. Jay is a member of the cheerleading squad. They perform the routine including the pyramid, jumps, and tumbling. While he is performing the back handspring, he accidentally twists his arm and causes muscle strain. What should you do to help Jay? To help Jay, you should apply the first aid rise approach. First, Let him rest to avoid activities that causes pain, swelling, or discomfort. Second, use an ice pack or slush of bath of ice and water for 15 to 20 minutes each time, and repeat this every 2 to 3 hours. Third, to help stop swelling, compress the area with a bandage or any cloth material that has with you until the swelling stops. Don't wrap it too tightly or it may hinder circulation. Lastly, elevate the injured area above the heart to help reduce swelling. Mitch and I are totally exhausted after we finish performing our PE activity. So, I took Mitch to their house, and when we are a few meters away, we saw how the huge fire ate in his home. The loss of his home shocked Mitch a lot, and with his exhausted body, he cannot take all of it anymore and collapsed. What should I need to do to help Mitch? First, check the danger and source of injury and make sure the surrounding is safe and out of danger. Second, touch or shake Mitch to test if he responds to any voice or action you make. Then, send for help to people who live near you or directly contact the emergency hotline.
Since he's not responding, tilt his head with his chin facing up and open his mouth and look inside to clear an airway.
Then check his breathing by looking, listening, and feeling his breathing signs. Lastly, since he is unconscious, no pulse and not breathing, immediately perform the CPR. In performing CPR, place your hand at the center of his chest and give 30 compressions in 18 seconds or less, and let his chest rise completely between compressions. After 30 compressions, give 2 rescue breaths. After that, repeat this cycle until help arrives or when there are signs of movement.